Hi, my name is Shelley and I am neurodivergent and I have neurodivergent children.
Hi, I'm Matt Eggleston. I'm a psychiatrist at CAF North in Christchurch. And yeah, I've got an interest in autism, ADHD, learning difficulties, but also just the general range of child and adolescent mental health conditions.
Matt, it's so lovely to talk to you today. We're going to cover off some stuff about mental health conditions and neurodiversity and medicating children today. Yes. How does medication help children?
So, medication has a role in helping children and adolescents with mental health conditions, and it varies a little bit according to what we're treating. So, sometimes medication has a very important role. So, for things like bipolar disorder or psychotic disorders, and with ADHD, it has a kind of like a leading role. And then for some other conditions, it has a support role. So, for moderate to severe anxiety or depression or OCD, um, it's not usually a leading treatment. It's often used after other therapies, but it has a support role and can facilitate therapy being more effective. And it has a bit of a role with things like bulimia and, and with Tourette's. And then there are some other conditions where it has really not much of a role, and that would be conditions where there aren't associated conditions that you can treat, so just single conditions, which isn't that common actually, but things like anorexia nervosa medications are usually not indicated unless there's something else. Behavioural disorders like conduct disorder or oppositional defiant disorder, or autism. So autism by itself we wouldn't treat, but autism, as you'll know, is often associated with other things that may benefit from treatment, and so we would treat those conditions, but not autism itself.
Right. So you can't go to a GP to get medication for your kids for these things.
Yeah, for some things, medication can be prescribed by GPs, but they're often a little bit reluctant because it's a specialty area, and they often have comfort with treating adults, but less comfort with treating children and adolescents, where the evidence base is a little bit more mixed, and where young people often have a different response to medications than adults.
So getting the medication at the right dose can be quite hard.
Yeah, and even choosing the right medicines. So an example might be venlafaxine for depression is very commonly used with adults, but is really extremely rarely used with adolescents, and only after multiple trials of other things have failed, because the evidence base is different. But GPs, yeah, they can initiate, often for adolescents, they'll initiate medication where people have had treatment in the community, some therapy, and things like, depression in adolescents. We do see some GPs prescribing for that. Other GPs will contact the service and try and get a recommendation from the consultant. But yeah, some things like ADHD, to get a special authority number, you need to see a specialist. And so GPs won't initiate